Diabetes is a familiar disease to us because we most likely have a family member or friend who suffers from it.
And if your medical or family history makes you more prone to developing diabetes, then you should take all the precautions necessary to reduce the risk of developing it.
So how do we treat and manage this condition? All we need to do is ask.
The more you ask and talk, the better we doctors can help you. Your health depends on you and me.
I'm Maricel Lacsa Pangilinan.
And I'm Dr. Oyi Balburias, and it's time to
Talk to Doc. When medical statistics are released, we often take it for granted, thinking that I'm not one of those who will acquire this disease or develop that disorder. Right, Doc Oyi?
That's true, and only when a patient becomes part of that statistic that he pays attention to what's ailing him.
Okay, so we will find out the numbers when it comes to diabetes. Ano nga ba tong numbers na ito?
Well, in 2007, the Department of Health released a data that about 3.6 million Filipinos are diabetics.
Wow.
And aside from those who are considered to be at risk, are undetected, about 4 to 5%, and about 8% are considered to be a pre-diabetic. But what's more alarming is that it's not limited only to elderly patients or middle age, but we also see among teenagers having diabetes or suffering from complications of diabetes.
No, it's really alarming. But it does not mean that it is hopeless. And if you have diabetes, there is hope.
And our story today shows how that is possible.
For more than 60 years, Teresita Guidote have been living a fruitful and happy life. Nothing has kept her from doing the things she did before, until she was found to have a coronary artery disease and diabetes.
I couldn't breathe, no. I knew I had something in the heart, no. That's why I went to him. And I think after I was hospitalized, he was the one already who looked at me, who checked with me.
The doctor who diagnosed her condition is Dr. Ruben Casala, an endocrinologist at the Medical City. Mrs. Guidote was a type 2 diabetic and had blocked arteries which caused poor blood circulation. She was advised to have a coronary bypass to treat her heart disease, but she and her family opted not to push through with the operation.
I just wanted to have the medications only, not the bypass. Natakot din ako. Baka ako kung ano mangyari.
With not undergoing the heart bypass operation, she was advised by Dr. Casala to cut down on her sugar and fat intake. Teresita was also given medications to lower both her blood pressure and blood sugar levels.
He gave me a list of medications, no? He told me about walking around as part of the exercise, no? I'm fond of sweets, no? And to hear that I will not be able to eat whatever I want, no? I felt so bad about it, no? But then if the doctor says it should be like that, okay.
Teresita took her doctor's advice to the heart, and with sheer dedication and passion, she now controls her diabetes and maintaining her blood sugar and cholesterol levels well.
Every 3 months, I go to him for checkup. And of course, the medicines, no, if it's not needed anymore, he crosses it out or lessens it. I had less occasions of having these chest pains, no? Until now. Ngayon, wala na akong iniinom na para sa sugar, eh.
More than a decade has passed since Teresita was diagnosed with her ailments, and nothing is stopping her from doing the things she loves to do. Even at 83, not even her diabetes. It's really inspiring to hear stories where patients are doing their best not to let their disorder get the better of them. Right, Doc Oyi?
That's right. And this just goes to show that diabetes can really be managed, even if you have other ailments like our patient Teresita Guidote.
Well, there's more to discuss about this disease, and we'll try to give you all that you need to know about it.
So keep it here. Talk to Doc. We'll be right back.